beneficiary population for care during pandemic. Setting up beneficiary kiosks by Kerala. Separate registration counter and ward for PMJ beneficiary in public hospital in Uttar Pradesh. Biometric finger scanners are replaced with iris scanners in Manipur. E-card generation using Panchayati Raj assistance in Bihar.
National Health Authority has developed Arogya Shiksha Platform, a learning management system for the administration, documentation, tracking, reporting and delivery of training programs related to Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. The platform has leading features like one-time registration and user profiling, tailored courses, assessment and certification, robust dashboard for monitoring, SMS and email notification, and access through mobile.
Ja, just det, om det skulle vara.
We are pleased to announce a grand launch of joint certification program for Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. This program is developed by NHA in collaboration with Insurance Institute of India. It is supported by the World Bank. The objective of this program is to develop skill and knowledge of relevant stakeholders for accurate and efficient processing of claims and prevention of fraud and abuse. It contains 3 courses for the people involved in medical audit, claim adjudication, and field investigation. Each course comprises of 2 parts: virtual or classroom sessions and online course. The first virtual course on medical audit is launched today.
मुस्कुराहटों की कहानियां पूरब से, सुकून के किस्से पश्चिम से, आत्मविश्वास की कथाएं दक्षिण से और हौसलों की आपबीतियां उत्तर से। देश का कोना कोना आयुष्मान हो रहा है। पिछले 2 वर्षों में 1.25 करोड़ से ज्यादा मुफ्त इलाज दिया गया, करोड़ों दिलों को छुआ। इन मुस्कुराहटों को शब्दों में पिरोया है हमने इन स्वर्णिम पन्नों पर। लाभार्थी की कहानियों का हर शब्द हमें प्रेरित करता है, भारत को आयुष्मान भारत बनाने के लक्ष्य की ओर बढ़ने के लिए।
Hi, good morning. Hi, Chris.
Good morning. This is Chris. Elias, can you hear me?
Hi, this is Anushri.
Uh, yes, we can hear you very clearly, Chris. Thanks for joining.
Good.
Thank you for joining.
Good to see you, Dr. Bouchan.
Yes, how are you? So we'll start in
Good.
2 minutes.
We'll
Okay.
request you, we'll request you to put your camera off for now. And when we invite you to speak, you can put your camera and your microphone, so you can switch it on at that time.
Great. Will do.
Thank you.
Okay.
हमारा नाम इब्रार अहमद है, डिस्ट्रिक्ट पटना का रहने वाला हूँ। पहले हम सिलाई का काम करते थे, उसी में अपने बच्चों को पालन करते थे। इसके बारे में करीब 2 बरस कबल हमको कुछ पता चला, बीमारी है तो ये डॉक्टर पेड़, वो डॉक्टर पेड़, पैसा भी बर्बाद हुआ और इलाज भी नहीं हुआ। प्रधानमंत्री नरेंद्र मोदी जी जो ये स्कीम लागू किए हैं, उनका बहुत बहुत हम शुक्रगुजार हूँ। हमारे जैसा गरीब और सहाय लोगों के जिंदगी में दोबारा जिंदगी डाल दिया।
आयुष्मान भारत हो, भारत आयुष्मान हो, आयुष्मान हो।
Today, as we mark the 2 years of Ayushman
I should look there, right? Good evening, ladies and gentlemen. Thank you so much for joining us. A very warm welcome to all of you. I am Anushri Goyal and I will be your host for this evening. Today, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana completes 2 years since its launch, and we are marking this occasion and its achievements through this virtual conference, Arogya Manthan 2.0. With the advent of Ayushman Bharat, India's dream of providing universal health coverage has never been closer to reality. In its first 2 years of implementation, Ayushman Bharat PMJ has reached close to 12.6 million Indians who have taken advantage of cashless secondary and tertiary treatments, resulting in savings of 1.8 billion US dollars for beneficiary families. The other pillar of Ayushman Bharat is also off to a strong start with over 20,000 health and wellness centers now providing expanded preventive, primary and promotive health services. In order to meet its goal of providing universal health coverage, India has pledged to ramp up healthcare spending to 2.5% by 2025, and UHC is a key sustainable development goal for 2030. However, there are some key challenges along the healthcare value chain and in health financing that India continues to tackle on its road to ensure UHC for 1.35 billion citizens. India still has a large uninsured missing middle comprising those who are neither eligible for Ayushman Bharat nor have their own or a company-sponsored health insurance cover. The groups typically face lack of awareness, affordability, and distribution that limit their access to health cover. Through this session, moving towards universal health coverage, we look forward to addressing key questions that are critical in India's path and journey in achieving universal health coverage. This evening, we have a distinguished panel of global leaders from across the world joining us. On behalf of the National Health Authority, I accord a very warm welcome to Dr. Harshvardhan, Honorable Union Minister for Health and Family Welfare, Government of India, Ms. Lena Allengren, Honorable Minister for Health and Social Affairs, Sweden, Dr. Abhijit Banerjee, Ford Foundation International Professor of Economics at MIT and Nobel Laureate, Dr. Tedros, Director General of the World Health Organization, Dr. Chris Elias, President of the Global Development Division at the Bill and Melinda Gates Foundation, and Dr. Indu Bhushan, Chief Executive Officer, National Health Authority, Government of India. We also have amongst us Dr. Praveen Gedam, Additional CEO, National Health Authority. So let us begin this evening with a short video on the journey of Ayushman Bharat.
चला चला से हटका पहिया चला चला से हटका पहिया लाचार नहीं बहना और भैया हर कोने में पहुंच रहा है सेहत का वरदान रवैया रवैया रांची से हुई शुरुआत ई कार्ड बन गए हाथों हाथ अस्पतालों का फैला नेटवर्क हुए करोड़ उपचार भैया चला चला सेहत का पहिया चला चला सेहत का पहिया चला सेहत का पहिया चला चला सेहत का पहिया पहुंच रहा है गांव शहर इलाज खर्च अब नहीं फिकर जन जन की मुस्कान बन रहा भारत आयुष्मान रवैया रवैया
देश के कोने कोने तक पहुंच रहा है मुफ्त इलाज के वरदान का पहिया ताकि जीवन का पहिया चलता ही रहे शहर गांव खलिहान कोना कोना हो रहा आयुष्मान भारत पीएमजे 5 लाख रुपए का मुफ्त उपचार प्रति वर्ष प्रति परिवार।
Without further ado, I introduce our first speaker, Dr. Indu Bhushan, Chief Executive Officer, National Health Authority. Dr. Bhushan leads the implementation of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, the flagship health assurance program of the Government of India that is providing access to secondary and tertiary healthcare to 500 million poorest citizens in India. Dr. Bhushan is also leading the implementation of the National Digital Health Mission in his current role as CEO. Until his appointment with the National Health Authority, he served as Director General East Asia Department of the Asian Development Bank in Manila, Philippines. Dr. Bhushan, I request you to please open the session and set the context.
Thank you very much. Honorable Union Minister for Health and Family Welfare, Dr. Harshvardhan, dignitaries from India and around the world who are joining us on this occasion, my colleagues from the National Health Authority, and friends and well-wishers. Today we mark the completion of 2 years of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. It was on this day in 2018 that Honorable Prime Minister Mr. Modi launched the scheme from Ranchi. His vision was that no poor person should be deprived of treatment in case of any serious illness that requires hospitalization. Neither should he or she become poorer because of the cost of treatment. Today is the day when we introspect and assess whether his vision is being met or what are the challenges that we still have in meeting the vision. I'm happy to report that despite the slowdown that we've seen because of COVID lockdown in past few months, our scheme has shown a very healthy momentum. 32 states and UTs out of 36 states that we have in India are implementing the scheme. We have provided close to 13 million treatments, while we have committed about 160 billion rupees in the scheme. Our beneficiaries actually have saved more than 300 billion rupees because of our highly competitive rates. We've issued more than 120 million e-cards and more than 23,000 hospitals have joined the mission. We have also more than 100,000 treatments which have been provided outside the state, as the beneficiaries can go and take treatment anywhere in the country as their benefits are portable. This is indeed an encouraging progress. However, the numbers do not tell us the entire story. The impact of the scheme actually has been far greater than what these numbers convey. We also have some very important learnings from the scheme. Here, I'd like to share 5 key lessons from the scheme. First lesson that has been there is that it is indeed possible to implement a scheme of the size and complexity of Ayushman Bharat. This scheme has more than 500 million beneficiaries spread across 36 states and union territories and are seeking treatment from more than 23,000 hospitals. This scheme could be launched in such a short period because of 2 factors. One, technology; second, flexibility. I'll focus on the second factor, which is actually very important in a country like India, where different states in the country have widely different contexts. They have different healthcare seeking behavior and very different implementation capacities. While Ayushman Bharat at national level, with its broad contours, is a one scheme, different states have adapted it to their context. This flexibility is also giving a fertile ground for innovation and creativity across the country. Second outcome that we see is that Ayushman Bharat has provided a framework and IT infrastructure for health assurance and universal health coverage in the country. States are now using this framework to converge various other ongoing health schemes, including those for employees with Ayushman Bharat. Various central government ministries are also planning to use the infrastructure to converge their schemes. The third issue is about the quality of care. We've seen that scheme like Ayushman Bharat, which is a demand side financing scheme, we can actually control quality because our financing is based on actual use of services by poor. So we can first enforce quality and standards. Secondly, we can mandate quality standards. Under Ayushman Bharat, we are incentivizing quality by providing greater payment to good quality hospitals, and we are mandating quality by specifying standard treatment protocols. Fourth issue is that use of artificial intelligence and machine learning can help in preventing, mitigating, and deterring fraud and abuse. We followed a zero tolerance policy against fraud, and we've used these techniques to create algorithms, and we are continuously improving on them to identify suspected cases of fraud and abuse. And last issue that I want to share is about the IT platform which was created, which not only helped with implementing the scheme, but also helped in getting having a good response to COVID. Our digital call center is supporting the helpline for COVID, fielding millions of calls. Our database is helping identify high-risk groups and provide them support. Our transaction management system is being used by many states to monitor the treatment of COVID patients, both PMJ patients and non-PMJ patients. PMJ is also providing building block for the newly launched National Digital Health Mission. Of course, 2 years is not a long period. We have far to go. There is still a large number of challenges for us. I'll share only five of them here. First, we need to strengthen continuum of care. We need to have much better linkage between primary, secondary, and tertiary care. We need to strengthen the referral system and ensure better follow-up of our patients. Some of them actually will require lifelong support. Therefore, this continuum of care is extremely critical in terms of providing quality care. Second, we need to get more private sector hospitals involved. Not only we need to impanel all good quality private sector hospitals in our network, but we also need to encourage greater investment in hospitals, especially in underserved areas, tier 2 and tier 3 cities and rural areas. 3, we need to continue and further deepen our work on prevention and deterrence of fraud and abuse. 4, we need to do more to reach the poorest of the poor. And finally, we need to strengthen our payment system and ensure that all hospitals are paid on time. We'll continue to work on these challenges and other challenges, and we want to make Ayushman Bharat one of the best schemes in the world. I thank you all again for joining us on this occasion, and we look forward to your guidance on how we can and should deepen the scheme further. Thank you once again.
Thank you, Dr. Bhushan, for taking us through the key learnings and challenges from Ayushman Bharat. Our next guest speaker is Dr. Christopher Elias. Dr. Elias is the president of the Global Development Division of the Bill and Melinda Gates Foundation. Dr. Elias's professional background is in public health and medicine. Prior to joining the Gates Foundation, he worked in various positions in countries for international not-profit organizations, most recently serving as the president and CEO of PATH. Dr. Elias, over to you.
Thank you. Good afternoon, and thank you for that kind introduction. And thank you, Dr. Bhushan, for organizing this important event. I'm delighted to have this opportunity to join you to mark the second anniversary of PMJ. I would like to thank the many distinguished leaders joining us today, especially Minister Harshvardhan and my fellow panelists, Minister Alengren, Dr. Tedros, and Professor Abhijit Banerjee. This event and your presence here today shows that your government is making a priority of giving all Indians access to the healthcare they need. This is an important celebration at a critical juncture in modern history. COVID-19 has done so much damage. It has slowed and in some cases reversed progress on the Sustainable Development Goals, and it has plunged the world into an economic recession. Of course, it's taken the lives of nearly 1 million people worldwide. But despite the damage done, it's important to remember that there's always a case for hope about the future. And this anniversary is a reminder that even when the situation seems dire, it's possible to set goals, act, and make progress. PMJ is proof that when people are motivated, they can solve complex problems and make life better. PMJ is the largest publicly funded health insurance system in the world. It was conceived and launched before the pandemic hit 2 years ago as a way to cover many healthcare costs for more than 500 million Indians so that health emergencies don't push them into poverty. Among the many exemplars in this program, there are 3 that I would like to call out in addition to the ones that Dr. Bhushan has highlighted. First, it's encouraging to see that despite the disruption of the pandemic, PMJ, since its inception, has already provided more than 13 million treatments for the most vulnerable citizens in India. It's even more encouraging to see the program's orientation towards gender equity in healthcare, with women making up nearly 50% of the beneficiaries of the program. Second, it's also impressive that over 23,000 hospitals in the majority of the states of India, 50% of which are private, have strong digitally backed purchasing systems that are AI-enabled and equipped to guard against fraud. And third, it's encouraging that PMJ has begun the journey of convergence with other tax-financed national and state programs to improve overall efficiency and quality of care. In fact, in this global emergency, they responded with urgency by approving more private hospitals for the program to ensure that more of the population has access to high-quality COVID-19 testing and treatment. COVID-19 has a similar galvanizing effect across global health. It's also made the stakes higher than ever. Health isn't just about health. It's also about economic well-being and about creating the conditions where all children, India and other countries thrive. Health is one of the most fundamental components of human capital. And it's always been true that societies that invest in their human capital are societies that prosper. But this truth has never been easier to see than right now, when what had appeared to be a health crisis rippled into every daily life around the world. The pandemic has not only underscored the need to invest in health, it's also pinpointed where those investments should focus. Unfortunately, health crises reveal the gaps in health systems. We've already seen a huge surge of innovation gaps quickly. We also now know much more about what we need to prioritize in the years and months to come. I see 4 other areas where India can prioritize, where it's already starting innovating to continue advancing toward the goal of universal health coverage. The first is human resources for health. A health system depends obviously on the people who run it, from those making policy decisions in ministries to those making clinical decisions in millions of communities. Making sure that all the people in the system, especially a system as vast as India's, have the skills they need is an immense challenge. So I was very impressed when just a few weeks ago, the government took on this challenge when it launched Mission Karma Yogi, a 5-year commitment to build capacity in the civil service sector. One of the most impressive parts of this is a state-of-the-art digital platform that provides 25 million government employees with access to cutting-edge tailored support. India has consistently pioneered digital innovations in health and development, and it would be impossible to imagine the government working effectively at scale without these kinds of tools. The second priority area is comprehensive disease surveillance. COVID-19 has underscored the importance of being able to detect and respond to disease in a swift and coordinated way. In this crisis, India has demonstrated that it is capable of real-time laboratory-based disease tracking and linking data from the block level all the way up to the national level to guide decision-making. The innovative work done to detect and respond to COVID-19 doesn't need to be a one-off response to a single disease. In fact, building high-quality disease surveillance into the national health system and making sure it's connected with the National Digital Health Mission's Universal Health ID will help the country identify, treat, contain, and prevent a whole range of diseases more effectively. The third priority is strengthening primary health care in urban areas. The story of COVID-19 and Dharavi, among one of the largest informal settlements in Asia, demonstrates the urgency of that need and points the way towards solution. India, like many countries, is urbanizing rapidly. Dharavi is home to 850,000 people in a space of just 2.5 square kilometers, 30 times more dense than the city of New York City. Not surprisingly, a lot of health experts were concerned that COVID-19 would spread like wildfire under those conditions. And yet the health system responded with a wide range of interventions, from screening, quarantining, and contact tracing, to minimizing the misinformation and stigma that prevented people from seeking testing or treatment. In just over 2 months, health workers screened almost 700,000 people. As a result of these heroic efforts, the doubling time of the virus has decreased by more than a factor of 4. And the disaster that so many anticipated was averted. India can invest to make sure that high quality care like this is routine for those living in fast growing urban areas. The fourth and final priority has already come up throughout my remarks, and that's using data to manage the health system and healthcare. Last month, the government launched the National Digital Health Mission to take advantage of India's world-class digital infrastructure to improve health. When data moves instantaneously through the health system, decision makers have the power to set the right strategies and execute them effectively and efficiently. The goal of the National Digital Health Mission is to integrate digital technology throughout the health system, from the ministry in Delhi down to the last mile, so that the providers have access to historic health records to inform healthcare. And most importantly, so that every Indian citizen will have the information they need to make choices about their own health right at their fingertips. While unfortunately there will be more difficult times ahead before COVID-19 is under control, I believe there's always a cause for optimism, especially in India. Ever since the Serum Institute of India developed a meningitis vaccine at an affordable price that no other company could deliver, I've been very impressed by the innovation capacity of India. Now, of course, the Serum Institute is stepping up to manufacture COVID-19 vaccines for low and middle income countries. Historically, the elimination of polio in India was one of the most impressive global health achievements I personally have ever seen. And now you're making huge strides towards universal health coverage. And it's immensely powerful and encouraging to see the bold ambition being realized just 2 years after the launch of the Ayushman Bharat program. PMJ will help help the fight against COVID-19, and it will help the country to rebuild on an even stronger foundation. Our hope is that the continued strengthening of the program, the PMJ network providers will deliver enhanced patient-centered care through adherence to standard treatment guidelines, and the innovative program will generate heightened awareness and empowerment among Indians who seek quality health care. We at the Bill and Melinda Gates Foundation are proud to be your partners. We commit to working alongside you as you continue to innovate to guarantee good health care for the Indian people and the thriving future of India. Thank you very much.
Restart.
Thank you, Dr. Elias, for sharing your insightful views. Our next guest needs no introduction, but I will say a few words about him. Dr. Tedros Adhanom is the Director General of the World Health Organization. He is an Ethiopian biologist, public health researcher, and official. Dr. Tedros served as Ethiopia's Minister of Foreign Affairs from 2012 to 2016, and as Ethiopia's Minister of Health from 2005 to 2012. He received the decoration of the Order of Serbian Flag in 2016 and was awarded the Jimmy and Rosalind Carter Humanitarian Award in recognition of his contributions to the field of public health in 2011. We will begin in a while. Dr. Tedros is perhaps running late, so we'll move to our next speaker.
Hi, colleagues. Thank you very much. I apologise. Dr. Tedros is currently speaking in another engagement. He'll be here very soon, and we apologise for the delay.
Sure. Thank you.
Thank you.
So let's move on to our next speaker. Our next guest is Dr. Abhijit Banerjee. Dr. Abhijit Vinayak Banerjee is the Ford Foundation International Professor of Economics at MIT. He is a co-recipient of the 2019 Nobel Memorial Prize in Economic Sciences for his groundbreaking work in development economics research. In 2003, he co-founded the Abdul Latif Jameel Poverty Action Lab, or JPAL, with Esther Duflo and Sendil Mulainathan, and he continues to be one of the lab's directors. I request Dr. Banerjee to please switch on his camera and microphone and address this session.
So, congratulations to Ayushman Bharat, PMJAY, for having crossed its first important milestone, and thank you for having me speak on this important occasion. I think that we are at an interesting and important juncture in the history of this very, very ambitious project. It's going to be one of the most ambitious healthcare insurance projects in the world, and one that obviously is needed, and there's no need to emphasize that more given the context of the COVID-19 epidemic. I think we all understand that healthcare is something that is going to be not just important for the lives of people, but also it's what will keep the lifeline of the economy going. And we're all relying on it to work better. The sense in which I think this is an important milestone is, I think now, according to the numbers I saw, 12.5 million families have been enrolled. That's something like 10% of the households that eventually will be enrolled. So and 23,000 hospitals have been used for those transactions. So that's of those households. So there will be 13 million transactions, something like 20,000 hospitals. So that says that it's reached a very substantial scale. By many global standards, it will be an enormous scale. In India, of course, it's still just a starting point, but it's one which says that, you know, the machinery now is mostly there. The sign-up process is not at the individual level. It's more or less automatized. So all of the processes involved have been sort of laid out, and they are beginning to work at a sort of anonymous level, which is the way it should operate. So all of that is clearly very important for the greater expansion of this project. And in that sense, I feel that this is an important step. In particular, I should remind the viewers that when the US did something actually on a much smaller scale with what is now called Obamacare expansion, the first 2 years were extremely choppy with many technological hitches, and And I think the fact that this technology is now working is already a major milestone. Having said that, I think this is not a moment for complacency. It's a moment for investigating what's working and what's not. That involves, I think, very importantly, careful data collection, collecting. I mean, both the volume of the data and the richness of it is going to be enormous, and that data is going to be very useful in understanding many of the questions. And with respect to Ayushman Bharat and with respect to the broader goal of moving towards universal healthcare. So I feel that this is a moment to carry out experiments, to try out new ideas, because I think we're going to learn a lot, both from the studying the data and for trying out new things. And in particular, I think the questions that we need to address are, why do some people join and others do not? What's stopping enrollment? What is it that they relatedly, what problems do they face when they try to enroll, when they try to sign up? What stops them or what makes it more difficult? What is it that, how are people reacting to the fact that, maybe some of their own healthcare providers are not empaneled, or they're not even eligible for participation? And, are they willing to switch? This is going to be a key issue with respect to UHC, because we know that the ecosystem of healthcare delivery in India is diverse and huge. And so what makes people more or less willing to switch? How is the care? Is it the case that the people who are coming with the insurance are getting the same care as the ones who are not? That's a key issue in the US. The US has been wrestling with this for a long time, that the people who come with government insurance or private insurance get different kinds of care. We heard rumbles of that during the COVID crisis. So I feel that this is a key issue. What's the auditing process? How is it working? What dangers are we finding? What are the problems that we need to worry about? These are going to be many of the same problems that will arise with going to UHC, just the vast number of people who need to be monitored, who will be certifying certain expenditures, but how do we know that those expenditures happen? So how are we doing on that? That's going to be other things we can do to make that work better. And perhaps most importantly, how is this connecting to the rest of the ecosystem? I think that's going to be critical, especially in the move to UHC. The rest of the ecosystem, meaning public health messaging, the range of people who treat people. I think there's as many of you know, something like 80% of all visits are to people who don't have, the MBBS degree, and of those people, and even none of the other sort of certified related degrees, the Ayush category, and those visits are, and 80% of those people who get those visits are not the non-government doctors who get those visits are actually don't have a medical degree, so any medical degree. So we are really talking about a vast infrastructure in which the official healthcare system is one small part. And how do we do that? Deal with that? The fact that the access to medicines is uncontrolled or mostly uncontrolled. Pharmacy, you can buy steroids in the pharmacy by just walking in and asking for them. the non-empaneled hospitals. How does the switch between those and the empaneled ones happen? So these are all parts of the existing system, and the existing system will not be fully replaced by anything. It's a huge system. It's impossible to imagine it being fully replaced. So we'll have to leverage that. We'll have to build on it. And I think one of the thoughts we start to think as we move towards universal healthcare is how do we build the relations between, for example, the secondary care or tertiary care that's mostly covered by Ayushman Bharat, and the primary care in the villages and in the low-income neighborhoods of the cities, which comes from these sort of quote-unquote doctors who are not necessarily trained, and how do we get them to actually triage properly, to send the right people onto the secondary and tertiary levels? That's a very important question. The right kind of monitoring of the government health workers. I mean, we know that, for example, in our work in Rajasthan, the attendance rates in some areas for the A&Ms in the sub-centers was 25%. There were one day out of 4 they were there. So that's a situation which is untenable, and that's how do we make that work better? How do we make sure that the pharmacies don't just dole out medicine at will? And so on. So there's a set of issues that we need to start thinking about if we're moving towards universal healthcare. And this is an opportunity because just the connection to Ayushman Bharat is going to make this problem already very salient. So it's a good opportunity to start working on that. And I think we'll have to develop a set of other interventions. I think training. I think while this is sometimes resisted, I think training the so-called doctors is very important. I think they need to be brought into the healthcare system, made aids to the PMJAY people, so that they don't do too much, but they at least do the right kind of triage. People will come to them. So I think that getting them enrolled into the public health process is important. Having them deliver the message is important. So I think that this is a moment where thinking about the training structures, thinking about the control structures, what do we do over these pharmacies that sell medicine, and thinking about the government's internal control structures. How do you get better performance from government healthcare workers? These are all critical issues, and it's an exciting, all of that makes it both worrying and exciting. I will take the exciting route. It's a day to celebrate. Congratulations to Ayushman Bharat for having reached this but critical milestone. And thank you very much for having me.
Thank you, Dr. Banerjee.
Please come.
So Dr. Tedros is here. Dr. Tedros Adhanom is Director General of the World Health Organization. Welcome, sir. A quick introduction. Dr. Tedros is an Ethiopian biologist, public health researcher, and official. Dr. Tedros served as Ethiopia's Minister of Foreign Affairs from 2012 to 2016 and as Ethiopia's Minister of Health from 2005 to 2012. He received the decoration of the Order of the Serbian Flag in 2016 and was awarded the Jimmy and Rosalind Carter Humanitarian Award in recognition of his contributions to the field of public health in 2011. Dr. Tedros, kindly take over. Thank you. I request you to please put your microphone on.
Thank you. Namaste. Your Excellency, Dr. Harsh Vardhan, Union Minister of Health and Family Welfare, Dr. Ashwini Kumar Chobi, State Minister of Health and Family Welfare, Excellencies, distinguished guests, dear colleagues and friends, Namaste again. I'm delighted to be able to join you today. At the United Nations General Assembly in New York last year, world leaders came together to adopt a landmark declaration on universal health coverage. But in India, you weren't waiting for a declaration. The Ayushman Bharat scheme implemented in 2018 is the largest health insurance scheme in history. Importantly, this investment has a strong emphasis on primary health care, with your commitment to create 150,000 health and wellness centers by 2022, providing a wide range of services. Ayushman Bharat has the potential to transform the lives of millions of Indians and to transform the future of India. You have many accomplishments to be proud of over the past 2 years. The scheme has been rolled out in 33 states and territories, covering 10 million people in May alone. I would like to congratulate Prime Minister Modi, the Government of India, and the National Health Authority for your vision and for your tireless efforts to realize that vision. You did not know when you launched Ayushman Bharat in 2018 that 2 years later you would be dealing with a national and global health crisis. I want to offer my deep condolences to every Indian family that's grieving the loss of someone they love. I offer my profound thanks, admiration, and respect for your health workers who are putting themselves in harm's way every day to serve others. I also thank Prime Minister Modi for his leadership in mounting a whole of government and whole of society approach. And I offer my unwavering commitment that WHO will continue to support you in every way possible. I know that you have already suffered so much, but with unity and solidarity, you can and will rise to the challenge. India will come and rise to the challenge. The effects of the pandemic will be far-reaching and long-lasting, as you know, going far beyond the suffering and health caused by the virus itself. COVID-19 has affected health systems all over the world, disrupting essential services for immunization, nutrition, maternal and reproductive health, and treatment for many diseases from HIV and TB to hypertension and diabetes. India is no exception. I congratulate the National Health Authority for the efforts you have made to support the COVID-19 response by providing free testing and treatment, partnering with Uber to support the transportation of health workers, and by engaging and educating communities to protect themselves, and for the social welfare support that you have provided to those affected by COVID. I also congratulate you for the innovative use of telemedicine through the e-Sanjivani clinics, providing free consultations for COVID-19 and all diseases. India is also a very important player in the COVAX facility. You are in a unique position as a Gavi-eligible country that will be both a major producer and a major user of COVID-19 vaccines. Excellencies, colleagues, and friends, it has never been clearer that universal health coverage and health security are two sides of the same coin. And it has never been clearer that health is not a reward for development. It is the foundation of social, economic, and political stability. India is proving that universal health coverage is not a luxury that only the richest countries can afford. All countries at all income levels can make progress with the resources they have. Ayushman Bharat is a very good example. It takes investment, but some of the best investments with the biggest returns are the most cost-effective. Too many countries devote too much of their health budgets to treating diseases in hospitals, where the costs are higher and the outcomes are often worse. Of course, hospitals are a vital part of every health system, but the best returns on investment are in primary health care, with an emphasis on promoting health and preventing disease, as you know and as you're doing through the Ayushman Bharat. It's better and cheaper to immunize girls against HPV now than to treat them for cervical cancer later in life. It's better and cheaper to promote healthy diets now than to treat diabetes and cardiovascular disease later. It's better and cheaper to invest in road safety than to deal with the victims of road traffic crashes in emergency rooms. Investing in primary health care pays a rich dividend. Countries that have made progress toward this universal health coverage have done so largely through public spending on health. Private health insurance can play an important complementary role, but no country has ever achieved universal health coverage through voluntary private funding. In those countries that rely predominantly on private spending, we tend to see large inequalities in health spending per capita, as well as in health outcomes according to socioeconomic status. In other words, those who can afford it get healthy, those who can't get sick. In that vein, we support the government of India's commitment to increasing public spending for health to 2.5% of GDP. We commend you for this. One of the best ways to generate revenue for health is through taxes on products that are harmful to health, including tobacco, alcohol, and sugary drinks. In Hungary, Georgia, and South Africa, these taxes have not only reduced consumption of these health-harming products, but have also raised additional revenue for health. But while the level of resources matters for improving service coverage and financial protection, improving efficiency in resource use is key. More money for health is good. More health for the money is even better. It's encouraging to see efforts to integrate health insurance schemes and funding pools in some states in India. Harmonizing schemes helps to reduce inefficiencies, cut duplication in service coverage, harmonize prices, and more. The transition to strategic purchasing is also vital for improving the quality of care while containing costs. And integrated and robust information systems are vital for generating the data needed to make the best policy decisions. I would like to recognize the bold steps that India is taking towards implementing the National Health Digital Blueprint. I pledge WHO support for this very important endeavor. Excellencies, colleagues, and friends, universal health coverage is fundamentally a political, not an economic choice. It's a choice that India has made, but it's not a choice you only make once. It's a choice that must be made every day in every policy decision. You have already come so far. I would like to suggest 3 signposts for the road ahead. First, reforms in smart spending and strategic purchasing will be vital for making the best use of resources. Second, integrating schemes for effective redistribution of risks will be critical to realizing the ambitious goal of leaving no one behind. And third, investments in information management systems, human resources, and primary health care are essential. Thank you once again for your commitment to our shared vision. It's not health for some. It's not health for most. It's health for all. Poor and rich, able and disabled, old and young, rural and urban, citizen and refugee. The challenges ahead of you are great, but so is the reward. A healthier, safer, and fairer India. Namaste.
Thank you, Dr. Tedros. Thank you, sir, for sharing your insightful remarks and invaluable thought leadership on this forum as we mark 2 years of Ayushman Bharat. Our next guest is Ms. Lena Hallengren, Honorable Minister for Health and Social Affairs, Government of Sweden. Minister Hallengren has also served as member of the Committee on Environment and Agriculture from 2006 to 2009 and later chaired the Committee on Transport and Communications from 2009 and to 2010 and the Committee on Education from 2014 to 2018. It is my honor to invite Minister Hallengren to please address the session.
Thank you. Minister of Health, Dr. Harshvardhan, Excellencies, ladies and gentlemen. A very good evening to you all. On behalf of the Swedish government, I want to thank you for inviting me to this very important event. It's a great pleasure of Arogya Manthan and the significant achievements made. I'm very impressed by the commitment by the government of India to achieve universal health coverage, a truly difficult task, and it's humbling trying to grasp the scale of it. Last year, during the Sweden-India Year of Health and celebration of 10th year of our Memorandum of Understanding on Health, I had the privilege to study the implementation of Ayushman Bharat firsthand in Delhi and in Jodhpur in Rajasthan. I visited both AIIMS and rural health and wellness centers and was impressed by the dedicated staff I got to meet and their ambitious goals. Since my trip, much has happened. The world is now in the midst of a gigantic pandemic that takes a huge toll on people, our healthcare, and our economy. The pandemic puts a flashlight on the importance of robust and equal healthcare systems. In this situation, we need people to seek care when they need it, and we need a healthcare system people can trust. Now we must work together to minimize the risk that hard-hit economies scale back on healthcare spending now when it's needed the most. There is no one quick fix to achieve universal health coverage. It takes years of efforts and political commitment. For my country, it started at least 100 years ago. This year, the Ministry of Health and Social Affairs turns 100 years old, and its creation was a sign that these issues had become important political topics. In the 30s and 40s, the debate was very lively, not least amongst the architects of the Swedish welfare state, for example, Miss Alva Myrdal, who later, among many achievements, became Swedish ambassador to India in the late 50s. She argued fiercely for free health care for all children, where one important ingredient was the creation of universal prophylactic child and maternal care. This is the year of the midwife, announced by WHO. You cannot underestimate the importance this profession has had for the health of Swedish mothers and children. These services were developed during the 60s and 70s, and today it is something that everyone takes for granted in support. Even if Sweden has universal health coverage, we still have room for improvement. For instance, expanding cost coverage for dental care for adults. I like to point this out because universal health coverage is not something you finish. It's something that needs to be built step by step, year by year. Sweden has a long history of a universal and comprehensive system of social protection. It includes publicly funded education systems and subsidized preschools. It includes social services such as healthcare, affordable healthcare, childcare, and care for older people, as well as social security for people in need. Sweden also has a social insurance system providing sickness insurance, unemployment benefits, universal child allowance, pensions, and paid parental leave for both parents, for example. Since 1947, all Swedes have each been assigned a unique personal identification number, which is used for contacts with the authorities. The number is also used for all healthcare documentation. And I know that in India you have the other system of unique personal identity numbers. The Swedish Parliament has adopted a public health bill for good and equitable public health for the entire population, with the aim of closing avoidable health gaps within a generation. And I heard that India is also planning on this, and I'm most interested to follow the development. We know that poor health is a root cause of poverty. not only because disease can disable you and prevent you from working and caring for your next of kin, but also because of high hospital and medical bills that can drive a family into poverty. The 2030 Agenda is a joint commitment and global vision towards sustainable development for all. Strong health systems with universal coverage are fundamental to achieving sustainable societies. Essential to achieving universal health coverage is the inclusion of sexual and reproductive health and rights interventions that safeguard women's and girls' rights to their own bodies and lives, which includes access to contraceptives and to safe and legal abortions. The provision of a comprehensive sexual and reproductive health package of services benefits both women and men, adolescents and children, and societies at large. In order to achieve gender equality, we also need the commitment of all men. Men and boys need to be engaged and participate in the process of change. Paying attention to the sexual and reproductive health of all groups, including girls and women, persons with disabilities, and the LGBTQI community will reduce the gaps in access, affordability, equity, and equality, and help us to achieve universality. In Sweden, and on a global level, we know that immunization is a key component of primary health care and indisputable human right. It's also one of the best health investments money can buy. Vaccines are also critical to the prevention and control of infectious disease outbreaks. They underpin global health security and will be a vital tool in the battle against antimicrobial resistance. Achieving universal health coverage is not possible without effective antibiotics. We have no time to lose. Antimicrobial resistance is a pressing global health threat. We must step up our efforts to curb this development. We must intensify cooperation at the national, regional, and global levels before it's too late. The outbreak of COVID-19 has brought new challenges and further illustrated the importance of a right-based approach to the health services, where access for everyone, regardless of ability to pay, gender, or social status, that is fundamental. Vulnerable and socioeconomically disadvantaged groups have especially been affected by the pandemic, including the elderly who got isolated in their homes or care facilities, and the chronically ill who had reduced access to health services. Primary health care is a cornerstone of all health systems. Effective primary care increases access to services, reduces avoidable hospital admissions, and can also contribute to improving the timeliness of healthcare services, as well as an equitable population health. In Sweden, we are in progress of strengthening our primary care structure that provides integrated, people-centered health services. Digitalization and medical technologies present new healthcare opportunities, and we're gearing our healthcare services to become more accessible and more digital. Even as the health and medical care system functions very well, Sweden, like all countries, need to prepare for a transition for healthcare to wellness in order to care for an aging population and an increased number of people with chronic diseases. According to an OECD report from 2017, on average, only 2.8% of member countries' healthcare budgets are invested in preventive measures. We know now much more about the underlying causes of many of the most common diseases, and this, in combination with technology developments for early diagnosis, to add health life years to people's lives. A truly inspiring challenge. Sweden believes in a strong and effective multilateral system. The global challenges we face today require global solutions and multilateral cooperation. Sustainable health gaps still exist today, but both between and within countries. And this is unacceptable. We must work together to ensure that these gaps are closed. The WHO plays a crucial part in supporting countries and coordinating the international response to this pandemic and in general. And once again, I'd like to reiterate our support for the WHO and the crucial work the organization is doing. Both Sweden and India, along with others, have a very important role to play in this global system and to make it robust. So ladies and gentlemen, Sweden and India have a long and strong, multifaceted collaboration in many sectors. We're guided by the India-Sweden Joint Action Plan that was signed in presence of our Prime Minister Löfven and Modi, and also by the recent innovation partnership wherein health and life science are important areas. The plan and the partnership are a testament to how our relations have developed and deepened. And I'm certain that we have much to learn from each other's knowledge and experience, not least from this ongoing pandemic in the years to come. Finally, let me end by saying that Sweden looks forward to working together with India to achieving universal health care for all. No one should be left behind. Thank you.
Thank you, Ms. Salgren, for sharing your deep insights and experience of universal health coverage in Sweden. Thank you so much. Our keynote speaker, Dr. Harshvardhan, Honorable Health and Family Welfare Minister, Government of India, had joined this session. However, he was called to the Parliament and will be joining from there shortly. In the meantime, I would request the video on the journey of Ayushman Bharat, our progress and the achievements of the scheme to be played.
Today, as we mark the 2 years of Ayushman Bharat PMJ, world's largest publicly funded health assurance scheme, it is time to reflect and assess the journey so far. It began around 2.5 years ago on 1st February 2018 with the announcement in the Union Budget by the then Finance Minister, late Shri Arun Jaitley ji, and the Cabinet approval in March 2018. In the next 6 months, the scheme design, the institutional structure, IT infrastructure, and implementation ecosystem of PMJ was fleshed out. It was done in consultation with the states and UTs in the spirit of cooperative federalism. As he launched the scheme on 23rd September 2018 from Ranchi, the Honorable Prime Minister said that with PMJ, India takes a giant leap towards providing accessible and affordable healthcare to the common person. The scheme was rolled out in 26 states and UTs on that day.
सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया। हमारे इस सदियों पुराने संकल्प को इसी शताब्दी में हमें पूरा करना है और उसका आज एक बहुमूल्य आरंभ हो रहा है।
Since the launch of the scheme, PMJ has achieved several milestones, including 1 crore hospital admissions in May 2020. This was achieved in less than 20 months since the launch of the scheme. The numbers tell only one part of the story. Let us hear the other part from the beneficiaries.
मेरा नाम शब्बीर है, मैं खतौली में रहता हूँ, मैं मिठलाल महल्ले में रहूँ, मजदूरी करता हूँ, उम्र मेरी 55 साल की है, दिल में परेशानी हुई थी, मुझे अटैक होया था। फिर उसके बाद में मैंने डॉक्टर को दिखाया, ये 4-5 लाख रुपए का खर्चा हो गए, ये बताया। तो वहाँ मैं आगे परेशान दिमाग हो गया कि यहाँ तो इलाज नहीं होगा। फिर हम घर पाए, घर पे आके वो आयुष्मान कार्ड देखा कि इससे कुछ लाभ होगा। ये हमने आयुष्मान कार्ड वालों से मालूम करा, फिर उन्होंने बताया कि इस पे इलाज फ्री हो जाएगा, वहाँ ले जाओ। तो अगले दिन हम तुरंत वहाँ चले गए। 2-3 दिन के बाद वहाँ एडमिट रहे, फिर उसके बाद में ऑपरेशन हो गया। 7-8-10 दिन बाद छुट्टी हो गई थी वहाँ से। वो आयुष्मान कार्ड ये फायदा होया कि फ्री में इलाज हो गया, नहीं तो हम परेशान रहते। फिर प्रधानमंत्री योजना को मैं बहुत लाभ मिला मुझे, जो मेरी जिंदगी बच गई, मैं इसे धन्यवाद देना चाहूँ।
The scheme was envisaged with 10.74 crore beneficiary families. However, currently it is providing free health cover to approximately 13.2 crore families due to addition of non-SECC families by implementing states and UTs. So far, 1.23 crore hospital admissions worth rupees 15,772 crores have been provided through a network of 23,311 hospitals across 32 states and UTs. The scheme has generated a savings of approximately rupees 30,000 crores to its beneficiaries. 1,25,454 hospital admissions have been authorized in non-patient states and UTs under portability of services. Kerala leads in the country with 6,549 hospital admissions per lakh beneficiary population, with approximately 8.1 bed available per thousand beneficiary population. Goa leads in the country. However, among the larger states, Karnataka and Jammu and Kashmir are the leaders. In the management of COVID-19 pandemic, NHA played a significant role by enabling free testing, free treatment for COVID-19 to AB PMJ beneficiaries, operating the National COVID-19 Helpline 1075 with 31 lakh calls answered, cleansing and verifying the COVID-19 patients' data shared by ICMR with 30 lakh calls dialed, assisting the Arogya Setu team by triaging and teleconsultation with 20 lakh calls. Let us now walk through the summary of last 1 year. Currently, 32 states and UTs are implementing the scheme. 21 states are doing so in trust mode. In the last 1 year, 4 states have migrated to trust mode. In the past year, several states, UTs, have implemented innovative approaches for effective implementation of the scheme. Jharkhand reached out to vulnerable beneficiary population for care during pandemic, and Kerala set up beneficiary kiosks, separate registration counter and ward for PMJ beneficiaries in public hospitals in UP, while in Manipur, biometric fingerprinting is replaced with iris scanners in view of the pandemic. Many other innovative approaches were implemented by Madhya Pradesh, Haryana, Tripura, Bihar, Jammu and Kashmir, and other states and UTs. In recognition of its contribution to digital transformation of health service delivery through PMJ, NHA was awarded National Gold Award for E-Governance 2019-2020 for its IT system, which is a digital marvel in the healthcare sector. During the last year, there were several IT innovations in PMJ. Standard Treatment Workflows, PMS 1.5, national and state data warehouses, along with development of IT platform for convergence for state schemes were implemented. PMJ health benefit packages were reviewed and rationalized based on a wide consultation with stakeholders. The rationalized health benefit packages, comprising 1,592 procedures, is being implemented in majority of the states and UTs. PMJ Quality Certification Program was launched and 163 hospitals, including 71 gold certifications, have been completed. Standard treatment guidelines were launched to make the treatment more evidence-based and outcome-driven. Ayushman Bharat Ki Chhav, Shehar Ho Ya Gaon campaign was launched to spread awareness amongst migrants about free COVID-19 testing and treatment under ABPMJ. Tools and platforms were developed for stakeholders' capacity building. Regional and national workshops were held for taking stock of the progress and peer learning. Beneficiary empowerment is key to ensure quality service delivery. In this direction, several initiatives, including 3-tier grievance redressal system, feedback over outbound call, and SMS-based intimation, have been taken. PMJ is governed by a zero-tolerance approach to any kind of fraud and abuse. The transaction data generated is monitored on a real-time basis. A fraud analytics control and tracking system has been developed for AI and machine learning-based fraud prevention, detection, and mitigation. A total of 171 hospitals were de-empaneled. Total penalties worth approximately 13 crores were levied on the errant entities. Insurance agencies and TPAs are key stakeholders of the scheme. Stakeholders meetings are organized for bi-directional.
Welcome back. I now have the honor and privilege of inviting Dr. Harshvardhan, Honorable Union Minister of Health and Family Welfare, India, as a keynote speaker. An experienced ENT surgeon, Dr. Vardhan has been in public life for nearly 3 decades. As a State Minister of Health in 1994, Dr. Vardhan oversaw the successful implementation of the pilot project of the Pulse Polio program, which eventually led to the nationwide immunization of 88 million children. Dr. Harshvardhan also serves as the chair of the World Health Organization's Executive Board. Request you, sir, to please address this virtual gathering.
Thank you. I understand that Ms. Lena Hellengren, the Honorable Minister for Health and Social Welfare, Sweden, spoke in this function and she is with us. And I understand that Dr. Tedros, our dear friend from World Health Organization, the Director General of WHO, he has also spoken and he is also with us. We had a message from Professor Abhijit Banerjee, Professor of Economics at MIT and 2019 Nobel Memorial Prize winner. And we have here in this function Dr. Christopher Elias, President Global Development Division, Bill and Melinda Gates Foundation. He is also there, and of course our CEO of the National Health Authority, the man helping us in spearheading this program in the country in a big way, Dr. Indu Bhushan, along with his colleagues, is also here. First of all, let me apologize for joining this function late because the Parliament was on and I had to just rush out of Parliament to be part of this function. And I'm really grateful to all these distinguished speakers, including the Honorable Minister of Health from Sweden and also our DG WHO and the great Dr. Important day for us. We just completed 2 years of our Ayushman Bharat, one of the most ambitious programs launched by India and probably one of the most ambitious program of the whole world now, moving very fast towards achieving the goal of universal health coverage for all its citizens. Ladies and gentlemen, I am indeed honored to be invited to address this prestigious gathering of eminent speakers. And of course, the occasion is historic for India. Let me begin by saying that my view on health has always been that health is a human right and not a privilege. All of you will agree with me that the right to health is fundamental to the right to life. Till 2018, the task of making the right to health a matter of human right and not one of privilege seemed impossible to achieve in India until a unique mission called the Pradhan Mantri Jan Arogya Yojana PMJ was launched by the Narendra Modi government to ensure quality and affordable health care for the underprivileged. This has been the most ambitious scheme of the Modi government in the last 6 years. Ayushman Bharat covers more than 107 million poor and vulnerable families, which means about 530 million people. This forms the bottom 40% of the India's population. Launched 2 years ago on September 23rd, exactly the same date on which we are meeting today. This is my government's flagship health insurance scheme and also the largest such scheme in the world. As a medical professional myself, I feel elated that Ayushman Bharat has made India the global leader in daring to tread the path of delinking healthcare from affluence and the ability to pay. This scheme has also showcased the strong political intent of our government to make a paradigm shift in the healthcare sector. In the healthcare sector, our government brought about two most important and path-breaking reforms. One, we disbanded the Medical Commission of India and created the National Medical Commission. With this, our government has already embarked upon the path to major reforms in medical education. Instead of the Medical Council of India, we now have the National Medical Commission. The second was Ayushman Bharat. And with this, we have laid the foundation for a disease-free India and for universal health care. I would say that Ayushman is indeed a historic mission, especially because it gives even a poor man the benefit of portability, which means that he could be a migrant worker and travel anywhere in the country and yet not lose his right to cashless health services. This is the best way to break the vicious circle of poverty and disease, as it grants financial protection against catastrophic health expenditure. The National Health Authority, under the able guidance of a dynamic CEO like Dr. Indu Bhushanji, has now completed 2 years. I must say the progress has been very, very heartening. It is even more heartening when Honorable Prime Minister Shri Narendra Modi ji describes that wherever he tours, he meets and interacts with Ayushman Bharat beneficiaries and hears directly from them about the positive impact and the positive impact that the scheme has made on their lives. I too have a personal experience of meeting some of the beneficiaries of Ayushman Bharat. It was in the year 2019, in the month of January, that I met a young girl from Haryana who wept when she met me. She narrated how her whole family had been devastated by her illness for many years and how her surgery was carried out with the help of this scheme. She called our Prime Minister a god and compared him with Lord Krishna. We still have that film in our archives. I was so overwhelmed that I personally captured on camera some of these stories from villages and towns across the country. We must understand the power of this scheme for the poor and vulnerable classes that had been exploited for decades in the name of healthcare. The financial burden of catastrophic health expenditure used to drive many families to suicide even. PMJ helps to get families back on track so that they can look forward to a bright and healthy future and achieve their dreams. The poor used to face heart-rending physical and emotional struggles prior to the launch of Ayushman Bharat. However, our government is committed to the poor and vulnerable sections of the society. Our Prime Minister has strategized tens of schemes for their upliftment. Ayushman Bharat showcases the vigor, determination and commitment of this government towards the larger goal of universal health care and inclusive growth. Along with empowering 500 million citizens, PMJ has provided fulcrum and flexibility for the states to increase their coverage to other vulnerable groups. Many states have already gone ahead in covering more population than that is covered under PMJ. I am told that roughly more than 100 million beneficiaries across India have been additionally covered by the states. Ayushman Bharat is also strengthening the entire health ecosystem. The government facilities have started utilizing the reimbursements under Ayushman Bharat PMJ to improve the existing services by upgrading the hospital infrastructure, recruiting talented personnel and procuring newer technologies. This is leading to a higher quality of service being offered in the hospitals. The private sector has also played a critical role in the success of the Ayushman Bharat PMJ. As Honorable Prime Minister had remarked in the Arogya Manthan 1.0, last year, around 11 lakh jobs are estimated to be generated due to Ayushman Bharat scheme in the next 5 to 7 years, which will make it the second largest employment creator after the railways. Ayushman Bharat is not only improving the health outcomes of the beneficiaries of the scheme, but also improving the standard of living of millions of families who are getting employment opportunities due to the scheme. Our momentum in implementing Ayushman Bharat will keep increasing every single day. However, this is not the time for complacency. Rather, we need to augment our efforts in catalyzing a more effective healthcare delivery through Ayushman Bharat. We are well aware of the fact that we must constantly focus towards improving the quality of care delivered at hospitals empaneled under Ayushman Bharat. We must develop various standard treatment workflows, improve hospital quality standards and ratings frameworks to ensure that the beneficiaries of Ayushman Bharat are given access to high quality secondary and tertiary health care. I am confident that Ayushman Bharat shall convert our vision into reality. We will have a new India that can boast of universal health care. The universal health care is a strong component of our Honorable Prime Minister's vision of Sabka Saath, Sabka Vikas, Sabka Vishwas. We want to empower the last mile beneficiary and ensure that the benefits reach each and every citizen of our vast country. I will end with a quote from my favorite poem by Sir Robert Frost. The woods are lovely, dark and deep, but I have promises to keep and miles to go before I sleep and miles to go before I sleep. Finally, I can say that our Ayushman Bharat journey has just started. I am extremely confident that in the years to come, Ayushman Bharat will be a key enabler in making our country more healthy, accessible and equitable. Ayushman Bharat Bhava, Bharat Ayushman Bhava. Many thanks for giving me the opportunity to speak to such an enlightened audience today.
Thank you, sir, for sharing your invaluable insights on Ayushman Bharat and sharing the way forward for the scheme and healthcare in India. I now request Dr. Praveen Gedam, Additional CEO, National Health Authority, to please deliver the closing remarks.
Respected dignitaries in this virtual gathering, Dr. Harshvardhan, Honorable Minister of Health and Family Welfare, Your Excellency Minister Lena Hellgren, Honorable Minister for Health and Social Sector, Sweden, His Excellency Dr. Tedros Adhanom, Director General of WHO, Dr. Abhijit Banerjee, Professor of Economics at MIT, Dr. Christopher Elias, President of Global Development Division of BMGF, and our CEO, Dr. Indu Bhushan. We at NHA are extremely grateful to you for taking time out of your extremely busy schedule and guiding us with your valuable insights. We assure you, all of sir and ma'am, that we will take forward this initiative of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana with even greater vigor and will ensure to achieve the goal of Sarve Bhavantu Sukhina, Sarve Santu Niramaya, as was stated by the Honorable Prime Minister when this scheme was launched 2 years ago. I also assure the distinguished panelists that we'll do our best in order to make our newly launched National Digital Health Mission success. We look forward to your leadership, sirs. I also thank my team at NHA and all the participants who have joined this from all over the world, and we look forward for more such interesting discussions over next days of Arogya Manthan. Thank you all.
Thank you, sir. With this, we come to the end of the session. Moving towards universal health coverage, we thank all our distinguished speakers for joining us this evening and raising the bar and prestige of this platform, Arogya Manthan 2.0. Before we close this session, we would like to screen a short video on Ayushman Bharat. Thank you all for joining. Have a great evening.
मेरा नाम हरिओम है। मेरी उम्र 22 साल है। मेरे घर में 8 लोग हैं। घर की स्थिति बहुत खराब है। 100-200 या 300 रुपए दिन में मिलता है, उसी से खर्चा चलता है। मैं काम करने गया था, टेंट का कैंची निकाल रहा था और कैंची लग गई। 11,000 की लाइन थी। मुझे झटका लगा, मैं गिर गया नीचे। हमारे घर में पैसा वैसा था नहीं। 2 अस्पतालों में जवाब हो गया था। फिर हिंद हॉस्पिटल में गए। वहाँ जब ये पता चला कि ये कार्ड लगता है आयुष्मान भारत का, अगर ये नहीं होता तो शायद हमारा इलाज नहीं हो पाता। सरकार का बहुत बहुत धन्यवाद, मोदी जी का बहुत बहुत धन्यवाद।
आयुष्मान भारत हो, भारत आयुष्मान हो, आयुष्मान हो।